Hello, fellow Americans. My name is John Dennis Wolfe. With 31 years in the field of health insurance and a book on the subject of healthcare cost delivery reform, I know the words I'm sharing with you here will be of value and will make you think. We do not have a healthcare crisis. The public never really understood what went on during the 1993-1994 congressional debates on proposed healthcare legislation. And that is why you need to understand now, more than ever before, we have a cost delivery crisis, and there is an enormous difference. I began my career as a health insurance broker upon graduating from San Jose State University, and I chose this career because I saw my success would come from helping others. I have achieved that goal, and now I would like to briefly talk to you about my book, The Sick Solution, A Prescription for National Health. This book was published in 1991, and this is the first time it is available to the public. If you truly want to know our system of healthcare and how it functions, I urge you to order my book today at Amazon.com or at any major online bookseller such as Borders, Target, etc. Here is an example of the information you will not hear today. In 1986, with the passing of the COBRA Amendment, it was instantly clear that healthcare security for Americans had started down the road to disaster. What Ted Kennedy could not get done in the 1980s through the front door, he did through the back door with his last-minute healthcare amendment attached to the Consolidated Omnibus Budget Reconciliation Act of 1986, COBRA. It was deceivingly brilliant. Many insurance carriers, unable to compete or handle the expected losses back then, pulled out of the small group business market, while others dramatically increased their rates to where few could afford to keep coverage. By 1991, millions of Americans were not covered, and a solution to the cost crisis had not yet emerged. All of this inspired me to write my book on healthcare reform, which I began in 1986 when COBRA passed. It was never released to the public, but in 1992 I sent it to key members of the committees in the U.S. House of Representatives. It became well known as a powerful source of debate in the 1993-1994 healthcare reform talks. What I sadly learned back then is that neither party cares about you. They had an opportunity to craft healthcare cost reform legislation that really could have meant something. Instead, what I witnessed then, and sadly we are seeing it again today, are a bunch of self-serving politicians seeking only as to how they could benefit from pork barrel spending for their congressional districts. What has changed since 1991? Nothing. Greed destroys honest and simple things in life. Just as it brought about the COBRA Amendment, sadly, greed and a grab for power have caused the reemergence of many of the problematic issues addressed in the 1993-1994 House debates. I again restate what I said in the opening of this presentation. We do not have a healthcare crisis. We have a cost delivery crisis. You must first and foremost understand that the present system of delivery is through a monopoly that controls the cost for delivering care. How can any institutionalized national healthcare program solve this problem? The answer is that it cannot. Now there seems to be an underground movement in this country sparked by Michael Moore's movie Sicko. This movie has given credibility to U.S. House Representative John Conyers, Democrat, Michigan, his proposed legislation to institutionalize health care. Do you really want institutionalized health care? I don't think so. Not if you understood what that meant. Said another way, if you do not read my book and learn what is really going on, you will not be able to fight against this type of legislation, and it will tell you where to go and when to receive care and how you're going to do it. Urgent care will not be available. You are expendable under a government-controlled national health care plan. Legislation is currently also being moved forward here in California that will further mutate our system into something so confusing and unrecognizable that if you were to actually need care, you would not know where to go. Or when you do find out, when you get to the right facility, you won't know anything what to do there either. These politicians do not desire to help the public, but rather to control healthcare dollars as they flow through the economy. Once they control the flow, they control the care. Once they control the care, they control you and me. From time to time, I will record updates and post them for your viewing. Please share this video with others and wake up. My book will help you. My fellow Americans, you are the solution.